The number of confirmed cases in the coronavirus outbreak racing across China and seeping around the globe rolled past 75,000 Wednesday, and though more than 2,000 people have died, many thousands more have recovered.
With no end to the outbreak in sight, health officials grapple with the issue of reinfection, whether people can catch the virus again.
Li Qin-Guan, director of pneumonia prevention and treatment at China-Japan Friendship Hospital in Beijing, said a protective antibody is generated in those who are infected.
However, in certain individuals, the antibody cannot last that long, Li said. For many patients who have been cured, there is a likelihood of relapse.
Li urged patients who have recovered from COVID-19 to be vigilant in their hygiene, such as washing their hands often.
Stay updated on the coronavirus. Get USA Today's daily briefing in your inbox.
Eng Eong Ooi, a professor of emerging infectious diseases at Singapore's Duke NUS Medical School, told USA Today the data is too new to determine definitively whether the immunity will last for a very short period of time, for years or for life.
Inflammation appears to be a cause of severe COVID-19. It also helps in the development of immunity, he said. But any conclusion will be premature. I fear we will need studies.
Coronavirus 20 times more lethal than the flu? Death toll passes 2,000.
China said Wednesday that it received 16 tons of face masks and other protective gear from the USA, the South China Morning Post reported. Foreign Ministry spokesman Geng Shuang said China hoped the United States would deliver on its promised $100 million donation to help contain the outbreak.
In the fight against the epidemic, all countries need to pitch in. Zhang said.
China has confirmed more than 74,000 cases. The USA has 29 confirmed cases.
China's authorities revoked the press credentials and ordered the expulsion of 3 Wall Street Journal reporters Wednesday in retaliation for a headline on an opinion column about coronavirus that Beijing said was racist. China's Ministry of Foreign Affairs objected to the headline, "China is the real sick man of Asia."
Many consider "sick man of Asia," which originally referred to China's international struggles a century ago, a derogatory term.
The incident came a day after the Trump administration said it will begin treating 5 major Chinese state-run media entities with U.S. operations as foreign embassies, requiring them to register their employees and U.S. property with the U.S. State Department. Wall Street Journal reporters expelled, China cites racist headline on op-ed. Chinese health officials said data indicates the outbreak may have peaked more than 2 weeks ago. The World Health Organization was unwilling to confirm the coronavirus may be in global remission. Tedros Adhanom Ghebreyesus, whose Director General, said that as more data comes in from China, global health experts get a clearer picture of the outbreak, how it's developing and where it could be headed. This trend must be interpreted very cautiously. Trends can change as new populations are affected, Tedros said at a news conference Tuesday. It's too early to tell if this reported decline will continue. Every scenario is still on the table. Tedros said who prioritized getting testing materials out to nations unable to quickly screen for the virus. Many of these countries have been sending samples to other countries for testing, waiting several days for results, he said. By week's end, 40 countries in Africa and 29 in the Americas are due to have the ability to detect COVID-19 and have the results in a day or two. We still have a chance of preventing a broader global crisis, Tedros said. Who will continue working night and day with all countries to prepare them. Contributing, Kim Helmgaard. Visualizing coronavirus, how it spreads.